Few people think of foot hygiene as part of their daily routine, yet it certainly should be. Because our feet are the foundation of our mobility, we need to care for them and pay attention to any particular problems that arise. Otherwise, our ability to walk, do chores, and engage in recreational activities may be compromised. Practicing good foot hygiene is a cornerstone of preventive foot health. Foot hygiene involves more than simply washing your feet when you take a bath or shower. We suggest following this three-part process. Part 1, get into a routine of daily foot care by following these 6 guidelines. Number 1, wash and thoroughly dry your feet every day. Use mild soap and wash between the toes, and be sure to dry thoroughly, especially between the toes as well. Number 2, to ensure that your feet are optimally protected, employ an integrated approach to the proper selection and fitting of your socks and shoes. Wear only padded socks with shoes that have non-slip outsoles and any inserts or orthotics that may be prescribed by your doctor or recommended by another foot health professional. Peer-reviewed published studies have even shown that clinically tested padded socks help to prevent injuries to the skin and the soft tissues of the foot by effectively reducing the pressure and shearing forces that stress the feet. It's also important to select shoes that are biomechanically well designed and have few seams or raised areas that could cause pressure points or rub the skin. And of course, wear inserts that are compatible with properly fitting footwear if you need them. Number 3, wear clean padded socks and change them at least daily, or even more frequently if you're active or if your feet perspire heavily. Again, we suggest padded socks for the moisture wicking properties. Man-made fibers or blends are engineered with wicking characteristics and help move moisture away from the feet, reducing the chances of problems such as athlete's foot or blisters. Number 4, keep shoes clean, inside as well as outside. Number 5, rotate your shoes. Don't wear the same pair 2 days in a row if you don't have to. Give your shoes time to dry out, especially if you're active or perspire heavily. Number 6, avoid going barefoot, especially in public areas. But if you do ever walk around barefooted, wash your feet carefully afterwards. Part 2, care for your toenails properly. Trim toenails regularly. We recommend at 2-week intervals. Cut them straight across, not on a curve, and file down sharp edges using an emery board. Use clean nail clippers or scissors, sanitizing them periodically by immersing them in alcohol. Don't attempt to cut your own toenails if you have trouble reaching them, if you can't see them, if you have any peripheral vascular disease or other circulatory issues in the feet and legs, if you have neuropathy, the loss of sensation or feeling in your feet, or if you have diabetes, with or without neuropathy. Instead, visit a foot health professional and leave the job of toenail trimming to that person. And seek medical attention for discolored toenails, which could indicate an underlying health problem. Healthy toenails should be pale pink where they are attached to the skin, and the part that grows beyond its attachment point to the skin should be clear. Lastly, don't put nail polish or lacquer on discolored toenails. And part 3, conduct daily inspections of your feet. There's simply no substitute for observation. Check the top and bottom of your feet, as well as your toes, between your toes, and your toenails. Look and feel for bumps, lumps, blisters or bruises, patches of thin or shiny skin, or areas of redness, cuts, sores, ingrown toenails with red puffy skin along the nail accompanied by tenderness or pain, and even cracked skin. The tiniest crack can easily become infected. Temperature differences, where one part of the foot may be warm and another part cold, might signal a lack of blood flow. Pain, tingling, numbness, or no feeling at all can signal nerve problems. And loss of hair on the foot or leg might indicate a circulation problem. If you have trouble seeing the bottom of other parts of your feet, use a mirror to help you. If your feet hurt and you can't tell what's causing the pain, or if pain doesn't go away on its own, don't delay in contacting your doctor or consulting with a foot health professional.